Miss Baker, I wanted to sit down and talk to you about your CT scan results today. Now, I know the resident physician already came and talked to you about the kidney stone that was seen on your CT scan, which is the cause of your pain and discomfort that you're experiencing today. But I actually wanted to sit down and talk about some of the other findings that were noted. On your CT scan, we have noted a couple of incidental findings. And what I mean by incidental is that these are things that are not related to why you're here today and are not causing any of your symptoms. However, there are things that will need some appropriate follow-up. One of the things noted on your CT scan was that you have a adrenal nodule, what's known as an adenoma. This is something that in most cases is benign. We see these roughly about 5 to 10% of the time when we perform CT scans of the abdomen on patients. 80% of the time, these are actually benign and have no clinical significance. However, 20% of the time, they can be very serious, including also cancerous. So in order to make sure that you don't have anything significant or and type of adrenal cancer, I need to send you to follow up with an appropriate primary care physician and possibly even a subspecialist. What you're going to need is some specific laboratory studies plus some dedicated imaging of your adrenal glands, and I want to make sure that you get that done. The other thing I wanted to mention was that you were also noted to have some coronary artery calcification. Now, coronary artery calcifications means that you have some calcified plaque in your coronary arteries. This is something that is of significance, and we need to make sure that we get some appropriate follow-up with a cardiologist. We don't know how much plaque you have in your coronary arteries. It could be 10%, it could be 90%. And so we're going to definitely need to make sure that you get appropriate follow-up. One of the things that you may need is what's called a nuclear stress test, or you may end up having a CT scan specifically of your coronary arteries to further determine how much plaque you have. Why this is important is that this puts you at risk for having a heart attack and sudden cardiac death. Now, in the meantime, I need you to take an aspirin daily, and I also need to have you monitor yourself for any type of chest pain, shortness of breath, dizziness, and any other symptoms that could be indicative of a heart attack. So if you experience any symptoms, I need you to come right back to the emergency department. But in the meantime, I want you to go ahead and set up an outpatient testing with a cardiologist to get this further looked at. If you have any questions, if you have any concerns, you're welcome to come back to the emergency department right away.